Hi everyone, welcome to my channel. I'm Dr. Madhumita and you know me as MedicoMadhu. Today we are going to talk about a very common topic. All of us suffer from vitamin deficiencies. So let's learn a little bit about the vitamins before we talk about their deficiencies. So we have fat-soluble vitamins and we have water-soluble vitamins. All of us know about this. So the fat-soluble vitamins are basically vitamin A, vitamin D, vitamin E and vitamin K. Whereas the water-soluble ones are vitamin B complex as well as vitamin C. So we will be talking about fat-soluble vitamins first and then we'll go to water-soluble vitamins. Fat-soluble vitamins. Why are they called fat-soluble? Because they basically need a little bit of fat in the diet so that they are absorbed better. So when we talk about fat-soluble vitamins, majority of the sources, even if you don't remember specifically, you can at least remember that the milk products can contribute to it because it has fat in it. First, we'll be discussing vitamin A deficiency. So vitamin A, we all know it as retinol, retinal, and a common thing because of the awareness that has been created in the by the government forum per se. Everyone knows it is related with vision abnormality. Well, it is not just vision abnormality, night blindness. It is also related to your skin. That's why in acne treatment, if you see one of the derivatives, retinal is given. It is also very important for your bone growth. So that's why you see that when in the infancy or in early childhood, a child misses on vitamin A, his or her skin will be very dry and not good looking. At the same time, the child would be stunted, not having adequate mass and not having adequate bone growth as well. The child will also have repeated infection. This affects the respiratory system as well as gastrointestinal system. So the child might have diarrhea as well. So how are we going to identify? As a mother, you please look at the skin. You please look whether your baby is gaining height and weight. Look at the nails. They will have brittle nails. The nails will break very frequently and they will have repeated infection. So to prevent it, simple thing in the diet as a mother or as a parent that you can give is basically, of course, milk products are good sources. Apart from that, if you are a non-vegetarian, you can go for liver, you can go for chicken, you can go for poultry-based food. You can, as a vegetarian, you can give carrot, you can give mangoes, you can give sweet potatoes, you can give green leafy vegetables. All these things will act as very good source. So if you're regularly supplementing the baby, if it is a minor nutritional deficiency, it would be corrected immediately. But if the child has already developed the manifestations that I mentioned before, then the child definitely requires supplement. So vitamin A is available in oral supplement irrespective of the age. It is available from infancy to adulthood. So you can go and meet the pediatrician or your own doctor. It doesn't need any specialized care. They will give the supplement and the babies or the adult per se, whoever has deficiency would be corrected at the earliest. Next, we will talk about the most favorite of everyone, vitamin D. There are a lot of talk going on about vitamin D. All of us know sun rays is very important for vitamin D. Well, that is one of the natural sources. Apart from that, you can definitely take fortified food in the diet. So this commonly talked about vitamin D, how is it going to help or how is its deficiency going to cause an issue for you? Well, it has its manifestation from head to toe. You will have what we commonly call as a flag sign. That is, anyone who has vitamin D deficiency will have the hair color changing. One set will have a particular color and then the other set will have light, like white color or gray colored hair, then again the normal color. So that is the reason it is called as flag sign. Apart from that, we all know that the minute we develop bony pain, even as common man, we think maybe I have some vitamin deficiency. It can be vitamin D deficiency. It is very important. Along with calcium, it contributes to your bone growth. So once you are exposed to sunlight, you will be able to convert it. There are people who have issues with absorption of vitamin D. these people might require a oral supplement or might require a injectable repeatedly because of deficiency. Vitamin D has been associated with immunity as well. So people with low vitamin D do complain of infections, and it has been hypothesized that it can result in diabetes or act as a contributing factor for diabetes mellitus. Many more studies are coming up which shows various other manifestations, not just the skin changes, hair changes and bone changes, but even other organs seems to be involved. The simplest way is to expose yourself to sun rays. Best time of absorption is actually between 10 to 3, but again, to avoid the cancer risk, you will have to minimize the exposure. So even in the daytime, let's say you're exposing yourself before 10 or after 3 p.m., try to avoid your sunscreens, because this is not the time where it is going to cause a cancerous risk or a sunburn. So that would be a better way to absorb the sunlight and vitamin D. This would help you a lot. We'll talk about vitamin E deficiency now. Vitamin E deficiency per se usually does not occur in Indians, mainly because we use a lot of seed based oils, whether it is nut oils or it is the sunflower oil or it can be the whole gram in your diet. So majority of the time we don't feel the necessity to take a vitamin E supplement until and unless you're extremely cautious about your diet and you're reducing all oil intake per se, or even the grains in your diet you're restricting, or let's say you're someone who has undergone a small bowel surgery, or you have small bowel syndrome, or you had a pancreatic issue, biliary issue, that is everything related to your gastrointestinal tract. If you had any surgeries or issues related to that, only then you develop vitamin E deficiency. As majority of you know that vitamin E is used for your hair, for your skin, so obviously the manifestations are going to be related to your skin, related to your hair. Apart from that, your balance issue, what we call as ataxia, can occur. Numbness, tingling sensation that involves your peripheral nerves in the hands, that is what we call as glove pattern or stocking pattern, that is in your feet. This is called as peripheral neuropathy. So it not only involves your skin, your hair, but also your nervous system. So definitely you will have to watch out for any of these symptoms, and we will have to treat it immediately. It can also present with forgetfulness. You might present with muscle weakness. You can also have some heart conduction defect, what we call as arrhythmias. That is, normally when you take a heartbeat, it will follow a particular rhythm. It would be like 1 2 3 4. So what we say is an arrhythmia is basically it would be 1 2 3 4 5 6, something like that, where it is not following a particular rhythm, and you will be feeling it as palpitation. That is, you will feel your heartbeat and you will realize that it is not something that is normal. So vitamin E is very important for your heart. It is very important for your brain per se, because it is going to cause nerve numbness, it is going to cause forgetfulness, what we call as dementia. So you will be immediately put on oral supplement based on your manifestations. We will be talking about vitamin K now. Vitamin K basically has three derivatives, of which one of the derivative is actually water soluble. The other two derivatives are basically fat soluble. So this is commonly not noticed because majority of the food that we cook involves usage of olive oil or canola oil, or even we use a lot of green leafy vegetables. So some form or the other we actually get vitamin K in our diet. People who are more prone to vitamin K deficiency are those who have malabsorption, or who had a pancreatic issue, or who had a bowel issue, because the bacteria in the bowel itself synthesizes vitamin K. So that again, if there is a bowel issue, it can result in vitamin K deficiency. If you're someone who consumes alcohol chronically, or you've been having repeated gastric infections, you tend to develop vitamin K deficiency. There is one condition called as hemorrhagic disease of newborn. In this, vitamin K is deficient. As soon as the baby is born, we notice that the baby is bleeding from different orifices. So immediately we get APTT and PT levels done, and we identify that the child is, or the infant is having vitamin K deficiency, and we give the child vitamin K injection and clear the deficiency. If you're an adult who has been taking alcohol or the conditions that I had mentioned, you are also prone to develop vitamin K deficiency. How are you going to identify this vitamin K deficiency as an adult? Let's say that you hurt yourself, a very trivial injury. It can result in bruises, what we call as ecchymosis or petechiae, or when you are just playing a game and you haven't even realized, you will notice a patch in your limb, which that is basically a blood patch that you see, or small dot sort of thing in your skin. Then there is a high possibility that you have vitamin K deficiency. It can be easily treated by giving vitamin K injection. So it is available only in injectable form. Apart from that, if your condition is pretty severe, we would also be giving you something called as FFP, fresh frozen plasma. So in this video, we discussed about fat-soluble vitamins A, D, E and K. In my next video, we will be discussing about water-soluble vitamins. For more informative videos, follow my channel and subscribe. Thank you.